Hi and welcome to Step Strides with me, Connor Ratcliffe, and today we're back in the garage gym and we're looking at some potential loading strategies for our calves, Achilles and plantar fascia. So this one's a nice easy setup. We're on our bench today, but chair, seat, anything where you can be semi-weight bearing and seated like this works perfectly. So you don't need a garage gym to do it. Now this is a nice exercise. It's going to be targeting soleus primarily, out of gastrocnemius and soleus within that calf muscle complex, because we're in the flexed knee position. So in this position it enables us to make gastrocnemius actively insufficient, and the more we flex our knee, the more it biases the load towards soleus. Because we're going to be going through digital dorsiflexion, we're going to get plantar fascia as well, and the Achilles tendon is the tendon portion of our calf muscles. It's all anatomically linked. So this is a good position because it enables us to have full range of semi-weight bearing and regressions of an exercise, and then incrementally build up through to progressions. So it's an easy position to add load into, depending on what you need to do and who your patient is and what your assessment, therapeutic aims, etc. have shown. So a couple of points for sort of added specificity and tips and tricks around this. Depending on where our foot position is, will alter the amount of load and the range of motion that we work through. So we mentioned about adding more flexion to knee. If we flex the knee more, it puts us in a more dorsiflexed position relatively. So the foot is relatively more dorsiflexed to leg and tibia, which means we're going to have a bigger range of motion in the sagittal plane. So as you work through plantar flexion, and then eccentrically come down nice and slowly to decelerate that dorsiflexion. If we kind of stack the leg underneath the knee, then we're going to come to perpendicular, and that limits the range a little bit. And the further we move the foot out, the more we put that foot into a relatively plantar flex position, and that's going to limit the range of motion that we work through. So based on our assessment and our patient's tolerance, we can modify this exercise quite easily, but it's something that you need to be aware of when you're setting this exercise up. The foot position relative to knee will make a difference to how difficult it is, and potentially modify actually your outcome and effectiveness of exercise. So it's a nice easy one. And to begin with, if we just want semi-weight bearing low load, then we can just be in this position. And what we're going to do is don't need to be biased in any way. We're just going to come up for one, hold for a count at 2, and come down for a count at 3. So really nice 1, 2, 3 second tempo that you'll see I use a lot in my videos because it's easy to remember. Patients understand what you're talking about, and it does typically what we want, which is bias eccentric phase of contraction, which is the 3 seconds slow coming down. Now, if I want to make this a little bit harder, but I don't want to add external weight, then I can get our patient or our clients to put a bit of pressure on top of their knees. So typically the cue I'll use is go into a position like you're about to stand up and get up out of the chair. So we're pushing down with our hands and our upper body as we come up for 1, hold for 2, down for 3. So we're adding a bit of external resistance there. Now, unlike some of our other modified versions where we're feeling pressure underneath the big toe or underneath the little toe, this can be spread evenly across metatarsals because we're not too worried about the frontal plane movement here. So inversion, eversion, depending on which structure we want to bias this to. So no additional cues required, just up for 1, hold for 2, focus on coming down really nice and slowly. Now, if we did want to progress this and make this more challenging, then this is an easy position to add load into. There's no balance requirements, you're not having to bend too much and all those things, and the grip requirement's a bit easier as well, so we don't need wrist straps and things if we're adding a lot of external load. If you're working with higher level athletes or people who are used to producing big forces, typically you will require bigger external load. So this is an easy position to do that in. Again, this flex knee position lets us bias towards soleus. So we've got our dumbbells here, and just do a couple of reps as an example. So resting on our thighs, the further you put these away, the harder they are to control, and typically the more it will feel like using heavier weight. So if we shift those down our thigh, then it creates a little bit of a bigger moment with the weight. It's further away from my hip joint, makes it a bit harder again. So we're going to come up for 1, hold for 2, down for a count of 3, exactly the same. Again, you need to make sure that this weight's appropriate for your patient, and we need to make sure that when they're getting the weight up off the ground onto thighs, the foot position is still appropriate, or we can shuffle back to increase that range of motion and put the foot into a more relatively dorsiflexed position. So, heavy weights. That is our seated double limb tiptoe raise for calf, Achilles, plantar fascia, but because of the bent knee position here and the flexed knee, we're specifically biasing the load to soleus.